Thank you so much for being right there with us. Going back to our discussion with Dr. Sunil Shroff. Now, Dr. Shroff, we were talking about the use of technology. How about the use of medical technology and in terms of the rural healthcare?
I think rural healthcare and technology is very exciting because, there are things which we can do, at least in India. We have 12 million people who are blind. And sometimes something as simple as a vitamin A is enough to cure their blindness. And to diagnose that kind of condition through the internet, through telemedicine, is not at all difficult. In India, we need to focus on the issues which are, I would call, low-hanging fruits. From the idea that there are certain things which we can prevent immediately, and one of them is blindness. Because we have a huge number of people who have deficiency, and simple cures can be taken care of. Cataract, diagnosis of cataract can be very easily done on telemedicine. Then look at the infant mortality rate, which is very high. The government of India can give some scanners, train some of the paramedical staff to do a scan, an ultrasound scan on pregnant women, and look at the fetuses, look at the congenital anomalies. Very simple things which are easily possible, and those images can be transmitted either in real time or by store and forward technology to another center where it can be easily diagnosed. So there's a huge opportunity as far as rural healthcare improvement is concerned. The government of India has been trying to talk about this health for all by 2020. And
is it possible? Is it a reality?
That dream is only possible if you use technology. Otherwise, it's just not possible. We would never be able to reach to the remotest corner of the country without technology. Even if you have doctors available, even if you have a shortened course, which the Medical Council of India is planning, even then you will not have enough people to reach out. So if you want to wipe away that kind of deficiency in rural healthcare, you have to use technology. And we have to use the paramedical force, train them. It's very simple. And have some doctors at the other end, to look at this.
So technology, you say, can play this role, not necessarily just at the level of a surgeon or a physician. It can go all the way through the health system itself.
Absolutely. Technology can do anything. It really is up to our imagination how far you want to take it. In fact, there are very exciting experiments going on in Australia where they have the same problem. Australia is a huge country, and to reach some of the remote kind of communities is very difficult. And they have set up these systems so brilliantly, and they're having huge successes. So we can do something much better than that in India. And what we must remember is that if we can do it in India, there are many developing countries in Africa, in South America, which should also benefit by our experiment, because today we have the best of medical force in the country, and we have the best of computer technocrats.
Right. So
and we have also technology, because telephony has reached the furthest corner of the country. So we have everything in place. So we are in the right time frame to be able to use technology for rural healthcare.
Right. Dr. Shroff, before I switch tracks, I want to ask you a very simple personal question. Were you at all frightened when you took up technology, when you approached it first?
Actually, my younger brother is, been, to a great extent instrumental in putting me on. Because I started using computers way back in 1980s.
Long time.
Yeah, long time. And so slowly I grew with the computers. I still can't type very well.
Okay.
But what I know is what I need to get out of the machine and what I need for my patient care. That much of common sense and logic I have. And that's what I do all the time.
Right.
That how to get the best out of this machine. It's an idiot box, as we all call it.
That's right.
But there's so much we can get out of it. How much of data storage it can do, how much of analysis it can do, and how much of networking it can do. So I know that. So that's why I'm not so afraid now of the machine.
Aren't you then? Good for you. Let me move into another area that you have a lot to do with, and that is organ donation and organ transplantation. Tell me, what is the situation in India in terms of organ donation?
If you talk of living donation,
yes,
then we have India is second or third country in the world which does the largest number of kidney transplants, because we, after US and another one or two countries, we do a huge number of living kidney transplants, because we have again very good surgeons who are able to do that. As far as organ donation per se is concerned, most of the donations come from living people. In many of that situation, it is not necessarily a relative who donates, it's an unrelated person who donates.
But that's not allowed, is it?
That's not allowed, but sometimes, when there is a small family and there is no relative, then people start looking elsewhere for donation. Unfortunately, what happens is, despite all the government rules and so on we have, there are ways of, beating the system, and people are able to, go through some procedure by which they are able to get somebody who we call CLD, commercial live donor. And they are able to get one of these people to be a related person, get all the paperwork properly done, and then you do have situations where unrelated donations do take place, and there is some commerce happening. What has been happening also by the side is that a disease donation program has started in the country. By disease donation, I mean is patients who are brain dead due to road traffic accidents or intracranial hemorrhage due to some cause like stroke or due to some kind of bleeding in a hemorrhage situation. In those situations, a person who is brain dead is on a ventilator, and in that situation, if the relatives say yes to organ donation, then almost the whole body can be recycled.
Right, but is it easy or to have people actually say that you can take all the organs, you can harvest the organs? I mean, isn't there this ethical moral issue here, Dr. Shroff?
What kind of ethical moral issue?
I mean, for instance, is it right for me to be actually doing that? Well, what do you think? Tell me.
I think, death as a concept is very difficult to understand. And I think we got it a little wrong, the word death itself. There's nothing like death. It is more about recycling.
Recycling.
If you look at the cosmos philosophy, there's nothing which dies and nothing which is born. Everything is recycled. The atoms which exist in you started when there was a Big Bang. Most of the hydrogen atoms come from that. And then, the carbon, oxygen, I'm talking on a higher plane.
Right, you are.
Those atoms have come along as such. And when somebody dies, it's only the structure which crumbles. But all the elements, all the molecules, all the atoms are all recycled. So there's nothing like, so the whole concept, the man concept of death is a little, I think it is something which is probably should not be taken as death. It should be more like recycle. Right. So I think there's nothing like anything wrong in recycling yourself if it helps a fellow human being, and to give them a second chance in life. It is the most wonderful act one can do.
Right, but as a doctor, do you find that people willingly come up and say, please go ahead, doctor, do this? Or do you have to persuade people? Do you have to talk to them? You've been involved in this, you need to tell me that.
Last 15 years, yes. And last 5 years, we've seen some paradigm shift in the attitude of people. In fact, last night, we had to turn down a donation because it was a baby who was born of anencephaly. Anencephaly is a condition where there's no part of the brain is missing. And so a baby cannot live, without machines. So we had a request, on an anencephaly baby from the parents to donate. We have had requests from, parents of as young as 1 year, 2 year babies, who the parents have come forward and asking, because nobody would dare in such a situation to go to the parents and ask for organ donation. So over the last 5 years, we've seen some paradigm shift. And we also have now trained people who ask for organs, like counselors. I'm involved with an organization called MOHAN, which is a acronym for Multi-Organ Harvesting Aid Network.
Right.
And we formed that in 1997. And we've done a lot of public education. We have distributed organ donor cards to people and so on. So now we get a lot of requests. Like day before yesterday, there was a donation which took place in a corporate hospital, and the family requested that they wanted to speak to the volunteers of MOHAN Foundation before they would make a donation. So we do see that now it's happening. I mean, that's the best way where you don't get the pressure. The doctors don't have the pressure to ask for organs. That would only come if we are able to educate a lot of masses.
Right. Dr. Shroff, when I come back, I'm going to talk to you and ask you about where India stands in terms of actual organ donation. Well, once again, time for us to go off for a very short while, but be right back with you here on We Connect.